On. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. We actually had a part one where we talked about low calcium levels. And so we were like, hey, this is great. So we decided to come back on and do a part two. And so we're going to now be talking about high calcium levels. I have Dr. Ramirez here with us. She is a great endocrinologist in my local area, Martinsburg, West Virginia. And so we're going to basically run through similar questions. So before I get started, I'm going to always start with introductions. For those that don't know me, my name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine. And I also own an aesthetic practice. And my goal is to have my patients not only feeling good, but looking good. So let's get on with the topic that we're talking about. Now, I'm going to introduce Dr. Ramirez. Her name, basically first name Sheila Ramirez, and she is board certified in endocrinology, diabetes, and nutrition. She's also board certified in obesity medicine. She's the co-owner of Novus Healthcare, where she practices full time. And she's actually, like I said, based in Martinsburg, West Virginia, where we are. All right. So Dr. Ramirez, thank you so much for coming on back.
Thank you, Dr. Uday, for having me again.
So we started with the last topic, kind of setting the foundation. So the same question again is, why is calcium important as far as the out levels in our body?
So the calcium levels regulate several functions in our body, regulates our hearts, the way our hearts beat, if they beat fast or slow, regulates the control for our bones, and it can also affect many tissues like the brain. And one of the big complications that we talked about before was calcium level could lead to seizures. But you'll see when we start talking about the symptoms that these symptoms are going to be completely different from what we talked about before.
Gotcha. So we're going to go right to the next question, and that's the symptoms for high calcium. So what are those?
So a lot of people can be very asymptomatic. I see a wide range of people that are only coming with a little bit of fatigue. I'm just feeling a little tired, not feeling like myself, to people that get very confused. Some people even gain a little bit of weight. And I think a lot of it is because of the decreased activity levels that they have. But that's what we mainly see. And another big referral base that I have is my ladies that have osteoporosis, especially if they don't have a family history of osteoporosis. It's very good to check the parathyroid level just to make sure that the osteoporosis is not a complication from the high calcium. The other source of referral that I have is kidney stones. Kidney stones can be caused by high calcium. And that is a treatable cause of it if we find that the parathyroid is the problem.
Gotcha. And then, so for the high calcium, what causes it?
Many things can cause high calcium. Some people take a lot of supplements and can make their calcium go high. Most of the time, the body is able to regulate that, but it gets to a point that it can. Another big reason is the parathyroid. The parathyroids are 4 tiny glands that are behind the thyroid, which is in front of our neck that most people talk about. But those 4 little glands that are behind the thyroid control calcium balance. So if one of them is a little bit uncontrolled and trying to make your body reabsorb a lot of calcium from your bones, it can go to your blood, and that can create the high calcium. Some people that have cancer can have high calcium. There's a group of medications that can cause high calcium too, and kidney disease can cause high calcium.
Gotcha. And then how is it diagnosed?
We diagnose through a fairly simple blood test that most doctors run is your comprehensive metabolic panel. That panel has your kidney, has your albumin. Just a simple calcium test can diagnose it.
Absolutely. And then how is it treated?
And first, we need to find out why it's happening, so we know how to treat it. That way, we can remove the cause. If it's caused by a lot of supplements, we reduce those supplements. If it's caused by a parathyroid problem, there's 2 ways of treating it. Some people can take a medication to decrease their calcium if it's high enough. Some other people can have to have surgery to get it removed. Sometimes with the kidney disease, they again can take some medications or have the parathyroids removed, and so on. But pretty much it's identifying the cause so we know how to treat it.
Gotcha. And then any complications from high calcium?
Yes, so a lot of confusion can happen from that. Especially if your patient is a little elderly. Some of the moms in nursing homes, we need to make sure that they get their calcium checked. You can get dehydrated because there's a lot of calcium also leaking out through the urine. You can have osteoporosis. That's where your bones can get weak and you have high risk of fractures. You can have kidney stones, which are fairly painful and can create another subset of complications. And those are the pretty big ones, and kidney failure from the high calcium that's leaking through your kidneys.
Gotcha. And then any tips on prevention for our listeners?
So try to make sure you talk to your doctors regarding which supplements you are or you're not to take. Also, making sure that you get your regular blood screening, especially if you're taking medications. Those are important. Your doctor's not just ordering tests because they want to have you get poked a lot. It's to monitor your medications, and that's how we do it.
I
And
love.
those are the big ones, and trying and making sure that you're aware of your symptoms and not brushing it off as I'm getting old because I'm fatigued. Make sure you go to the doctor and talk about them.
Awesome. Thank you so much. This I'm pretty sure this is going to be helpful to a whole lot of people. So, I guess the other question then becomes how can people find you or connect with you?
So we uh, we have a practice in Martinsburg where you are. We're local, and just have to give us a call at the office. The number is 304-260-1436, and we'll set you up with an appointment and review your records and make sure we figure out what the issues are.
That's awesome. Thank you so much, Dr. Ramirez. This is amazing. Thank you. Thank you.
You're so welcome. Thank you for having me again.
Yay. And then for those of you that are looking for a primary care doctor, we are accepting new patients at Apple Valley Family Medicine. Our number here is 304-350-1087. And you can also find us online at www.applevalleyfamilymed. So contact us if you need it, and we'll be happy to help you. All right, you guys, that's what we have for you. You guys have an amazing week. All right, bye.
Thank you. Bye bye. Have a good week.